So today's topic is treatment-resistant atopic dog. And before we start, I'd like to thank all of you who joined. There is 18 countries and we raised more than 3,000 euros. That's a huge help to Ukrainian people, and thank you very much. I guess you all see from time to time these treatment-resistant atopic dogs. That means you treat them or somebody else you collect treated them, but here it is, still itchy, not responding or not responding enough. So today let's talk about possible reasons for that not responding, and what is more important even, some solutions for that. And I probably should define a bit these patients, this atopic dog. What do I mean under atopic dog? I mean that it's a dog who diagnosed with environmental allergy. So this dog is having hypersensitivity to different airborne allergens, house dust mites, storage mites, pollens, maybe mold spores, maybe other animal, birds, or why not people allergens. And this dog may or may not have classical atopic dermatitis pattern. You all know this pattern. I will not talk about it. So the dog may not have this clinical picture. It may be different, but it's still diagnosed with environmental allergy. Okay, first scenario, first option, why this dog is not answering to a treatment. This dog may be not atopic dog, and it may sound strange, but I've seen these dogs. I've seen them a lot that was mistaken for atopy, but it was actually different disease. For example, here on the left you can see the dog who was treated for months like an allergic dog, and diet was made and everything, and even allergy test was made and was positive for house dust mites hypersensitivity. But in fact this dog is having scabies, sarcoptosis, and by the way, Sarcoptes mite hypersensitivity to Sarcoptes mites antibodies to Sarcoptes mites may be cross-reactive with house dust mites. That's why many of them will be how to say, wrong positive, false positive to house dust mites, and that's why we should not use allergy test as a diagnostic tool to diagnose allergy, right? This one in the center again was treated for allergies for more than year, and this dog is actually having fungal infection with trichophyton, and it's wrong to assume that every dog with infection or parasites will not answer at all to antipruritic treatment, anti-allergic treatment, or will become worse. Actually, the truth is they may be controlled to some extent, and it will be mistakenly taken as they are allergic but just not responding well. So actually this dog was better on Apoquel. It was less pruritic, but the lesions were not going away, but at the same time the dog was not becoming bald everywhere, right? The disease, the fungal infection stayed here on the face, that's all. And this dog, it's an European, this dog is an older dog, and started to develop some erythematous scaling, sometimes erosive, like here on the pinna, lesions that were painful and pruritic. Was treated for allergies, but actually it's a dog with epitheliotropic lymphoma. Yes, even tumors, especially epitheliotropic lymphoma, can mimic sometimes allergic diseases. So be careful if you received the dog, atopic dog, even with a long story of treatment, atopic treatment, allergy treatment, but history and examination raise any doubts. Start from the scratch, revise the diagnosis, take new scrapings, new cytologies, fungal culture if needed, trial therapy. By trial therapy, I mostly mean anti-parasitic trial therapy to be sure that there is no scabies, other pruritic skin parasites involved, because you don't find them every time you look for them, right? And maybe even you will need biopsy to establish final diagnosis. Second option, there is atopic dermatitis, but it's not answering well because there is something else. For example, there is some other allergy that is not controlled. And you know that atopic dog is born predisposed to develop hypersensitivity to different proteins. It could be flea saliva proteins or proteins in the menu. So it's not rare that our atopic environmental allergic dog could be allergic to something else, and maybe this additional allergy is not controlled. So check that and revise flea control, revise the diet, or maybe start a new elimination diet, right? Even if there was an elimination diet done before. Atopic dermatitis never promised that it will be alone forever. So atopic dermatitis can be joined but by other pruritic disease. Mostly there are parasites, skin parasites, that can make itch and skin inflammation worse. And the dog who was perfectly controlled before suddenly is not controlled anymore. For example, here on the left, you can see the dog with otitis externa that looks pretty much like atopic otitis, right? There is some erythema, some brownish discharge, but actually this dog is having otodectosis, otodectic ear mites. This Weimaraner on the right is actually having quite mild atopic dermatitis, and it was controlled with some local corticosteroids, with Cortavan spray and some buffing and some food supplement with fatty acids. But suddenly it became much more pruritic. Spray couldn't help anymore, and you can see there is lesions, mostly they are from self-trauma, alopecia, erythema, some lesions on the thigh and flanks, and these dogs is having scabies, sarcoptosis. And remember, these dogs who are atopic and reacting to house dust mites, after contact with sarcoptic mites, they usually don't need a long of time to react like other dog, like healthy dog. It may sometimes need 2 weeks or so to become pruritic. These dogs may become pruritic very quickly during a couple of days because of this cross reaction, hypersensitivity cross reaction to dust mites, for example. So if it was your patient, ask him for a check. If the owner emails you or phone you and saying, you know what, my dog is feeling worse and it's itchy and it's inflamed, don't adjust atopy treatment online. Ask them to come, revise history, examine them, and try to exclude or confirm some additional parasites. If you didn't find anybody, start trial therapy for skin parasites. Actually, when this dog came to clinic during history, I found out that there is kitten, new new pet in the family that was found on the street, and actually the kitten was feeling good, and the ears didn't look inflamed or pruritic. But you know that a lot of kitten or cats may have almost asymptomatic disease, right? And this Weimaraner, when I was asking owner the questions, owner was showing me, you know what, there is also some pruritic lesions on my hands. Can it be related to dog disease? And of course it can be related, and this is so-called pseudoscabies, right? Sarcoptic mites may live for some time in human skin. They don't go full circle of life, right? They cannot multiply in human skin, but still they can create pruritic lesions. And sometimes atopic dermatitis would be joined by other not so common disease, and maybe this disease is not even pruritic by itself, but still creating new lesions, and suddenly this dog is not controlled anymore, right? And this one on the left, it's a nibble, it's a Shar-Pei dog who was for years treated for atopic dermatitis, and it has atopic dermatitis. But suddenly there is a lot of pustules, and you can see here a dozen of them on this nibble. And it's not responding to antibiotics or antimicrobial treatment, and actually it has pemphigus foliaceus. Yes, sometimes atopic dermatitis will be joined by a rare disease. And this German Shepherd, for years it's atopic, and it's actually quite good control. But the owner was emailing me, you know what, my dog is losing hair, and it's progressive, and it's not pruritic. I said, you sure it's not pruritic and losing hair? Please come for a check. And actually it was a dog who developed hypothyroiditis, right? And this one, it's also German Shepherd, but different one, and it's a paw, and here is a claw that you see, and it started to develop some ulcerative lesions on the paw. They are a bit pruritic or painful. At least the dog was licking the paw, right? But when it came for a check, it didn't feel right. It didn't look like this ulceration was creating by leaking, by self-trauma. So it's actually a tumor. It's ungual melanoma, right? So always ask these patients who suddenly become not so responsive to treatment anymore or developing new lesions, strange lesions. Ask them always for recheck. Don't change the anti-allergic treatment. Don't raise the dosages. Ask them for recheck and examine them. Do some more diagnostics to be sure it's still atopic dermatitis, not something else. And a lot of our patients, they receive long anti-inflammatory treatment that may suppress immune system. So we may see some skin side effects from this treatment. So it will be atopic dermatitis plus something else, and in this case, plus side effects of the treatment we started. And here you can see the dog under treatment who developed alopecia, erythema, scaling, crusting. The head was pruritic, and it's actually the dog with adult starting dermatosis, I think, due to the long treatment with corticosteroids. Here on the right is a golden retriever with some erythema, some raised lesions that are pruritic and painful. The dog is licking them, and this is skin calcinosis cutis, again due to long-term treatment with corticosteroids. Actually, it's not long-term every time. Some dogs are quite susceptible to corticosteroid treatment, and they may develop skin calcinosis pretty soon, in a few weeks after starting prednisolone, for example. And it's not necessarily a huge dosage. Sometimes it's quite low dosages and not so long treatment, and voila, you dog have calcinosis cutis. And by owner, these new lesions again may be regarded as a complication of allergy. So I saw a lot of cases that the owner by himself, herself, is raising prednisolone dosage, thinking that the dose should be raised because allergy is not controlled anymore. And here on the right is West Highland White Terrier, and it was treated for atopy with two different anti-inflammatory drugs with combinations of cyclosporin and prednisolone, because it was not answering to just one. And at some point there was ulcerative, hyperplastic, painful lesion on the front paw. The dog was licking, and that was so painful he cannot stand on this paw anymore. And it actually was a rare opportunistic infection with nocardia. Nocardia is a saprophyte, is a bacteria that lives in the environment and usually is not causing any problems. But in a dog with immune suppression, if there is traumatic inoculation into the skin, it may develop this bad infection. So again, always recheck these atopic dogs who developed other lesions, who started not to be responsive to the treatment they were responsive before, and maybe you need further diagnostics to be sure what it is. So first scenario, first option, actual mistakes in the management of atopic dermatitis. So the one that I see a lot is a mistake that you treat infections, secondary infections. So atopic dogs are very often develop additional staphylococcal infection or yeast malassezia infection overgrowth that may create a lot of lesions, a lot of pruritus, but still its secondary infection is just the top of the iceberg. You should not treat only infection. If you do that, the response will be limited or short, and the infection will be back very soon after you stopped your treatment. So it's not right to treat just secondary infections. Primary disease, underlying disease should be treated. In this case, atopic dermatitis, right? Another mistake, you don't treat infections, you disregard the infections. It's not right also. Sometimes this atopic dog develop bad secondary infections. In this case on the left, it's furunculosis, and it should be treated with antibacterial therapy, right? This Labrador on the left, on the right, sorry, it has a bad malassezia dermatitis between the digits, and you can see this brownish discoloration of the hairs from permanent leaking. Actually, this Labrador was leaking its paws non-stop, even at nights, and even this Elizabethan color can't help it. Soon after this malassezia overgrowth was controlled, immediately in a week or so, this Labrador was not leaking its paws anymore. So before it was on the low dosage of prednisolone, not responding, having a lot of polyuria, polydipsia, wearing this Elizabethan collar. The owner was desperate, and soon after just controlling this malassezia infection, it doesn't need any more systemic corticosteroids. It was like local spray, Cortavan spray, and anti-yeast treatment, and that was enough to control its symptoms. So establish what are you dealing with what secondary infection you deal with. If you need, if there is pyoderma, if you need take material for bacterial culture, especially if the dog was treated before, especially if it's not treated just once with some antibiotics, especially if the dose was not right and the course, the length of the course was not right. So you suspect that maybe there is not responsive bacteria. Take bacterial culture and start antibacterial, antimicrobial treatment. In a lot of cases, local treatment will be enough, but sometimes you will need also systemic, even for yeasts. In other treatment mistakes, we forget to use all the options we have to control atopic dermatitis. So you may ask, what options do we have? And I would say there is these 4 groups of options that should be used almost in all atopic patients. And let's start with allergen avoidance. Of course, it's not something we can do in every case, and as we deal with environmental allergens that are everywhere, it's not possible to control all of them. It's not possible to control um, to reduce the concentration, like lower it by zero, right? But sometimes we can do something and it may be helpful. For example, if there is some pollen allergy, um, establish what pollens they are, establish what time of the year there is a high concentration of that, of these pollens, and maybe you should advise not to walk in this area or during the high pollination season, right? If the dog is living or spending a lot of time outdoor, keep lawns short. Advise to rinse the dog after a walk. Maybe if it's a huge dog, or just rinse the paws. But you remember that allergens um, get inside the body through the skin. So rinse them mechanically, remove them from the skin. And maybe use some cloth when walking to reduce the concentration of the allergens directly contacting with the skins. Maybe use on the paws some, how to call them, you understand me, something to protect the paws, right? If there are mites, house dust mites involved, keep the dog out of the bedroom. Maybe if it's possible, out of the house, keep him outdoor as much as possible. Use vacuum cleaners a lot. Use hypoallergenic mattresses for the dog or for yourself, some anti-allergenic pillow covers, right? Avoid some stuffed toys, avoid anything, carpets maybe that are with high concentration of dust and possibly house dust mites. Wash your bedding with hot water and maybe even apply some anti-dust mite sprays in the house. If there is storage mite allergy, you know that storage mites may live in not only in a human food but also in a dog food. So advise to use some smaller packages of the dry dog food that you can close hermetically, maybe store them in a freezer even, or maybe completely change the menu for the vet food, right? Anti-inflammatory therapy. We don't have a lot of effective options, but still we have much more than just prednisolone or just corticosteroids. So be sure that you tried every option: cyclosporin, oclacitinib, lokivetmab. You tried all of them, right? And if needed, combine them. For example, cyclosporin is often combined with corticosteroids and oclacitinib, especially in the beginning of treatment, because you know that cyclosporin is quite needs some time, quite slow. Sometimes it's even 3, 4, 5 weeks until the cyclosporin is effective. So in the beginning, first months, I often use cyclosporin with prednisolone or aclacitinib, right? Sometimes it's not just the beginning. Sometimes it's a dog, atopic dog, who responds pretty well to cyclosporin, but sometimes needs some short courses of quickly acting antipruritic drug, prednisolone or aclacitinib. For example, it's a period during a high concentration of pollens, and the whole year is the dog is quite well controlled with cyclosporin, but this time it needs some support, additional support. Or sometimes cyclosporin is not something that can control 100% of all the itch. You cannot raise the dose because with higher dose there will be side effects, for example. So you add to cyclosporin something else, like a bit of prednisolone or a bit of aclacitinib. Maybe with you don't want to use prednisolone alone because there will be side effects, right? But if you add to this cyclosporin some low dosage of prednisolone, like sometimes it's pretty low, it's like 0.1 or 0.2 milligram per kg every other day, it will be enough to control this dog, right? And maybe this dog is not controlled just with apaquel, or it's a dog giving just apaquel is not something that owner can allow. It's too expensive, right? So you give cyclosporin and just on some bad days oclacitinib, right? Another possibility, the dog is controlled with oclacitinib or lokivetmab, SATA point, right? But sometimes there are some bad days or some bad weeks, and then you need the help of prednisolone, right? So combine them if alone is not effective. Sometimes the dosage is not right. It's too small, especially if it's a large dog, an expensive treatment. We tend not to use enough, right? And sometimes it's not anything to do with owner. We ourselves, like subconsciously, use lower dosages. For example, with apaquel, maybe maybe apaquel was effective, but when you started to lower the dosage as manufacturer suggests, right? When you, after a couple of weeks, start to lower the dosages by half, the pruritus will be back. So maybe this dog should be controlled with larger doses of apaquel. Yes, it will be off-label, but this dog will be adequately controlled. And we know there is a few studies by now that tell us oclacitinib in larger doses can be quite safe even for long periods. Or for example, Cytopoint in Europe is the recommended dosage is 1 milligram per kilogram, right? In America, it's double this dose to 2 milligrams per kilograms. And I can see that some dog will not respond to this lower dosage, but will respond, and the response will be longer with 2 milligrams per kilogram. So adjust the dose if needed, even if sometimes it needs to be off-label. Of course, you talk, you discuss with owner this off-label dosage, and you agree on it before you do it. Sometimes there is not long intervals enough. For example, I can see that lots of atopic patients, they need year-round, everyday, long life treatment. But for some reason, there are some short courses of whatever treatment, prednisolone or apaquel, for example, right? It's not enough. The dog starts to be pruritic again, and then the owner or sometimes the doctor waits until it's real pruritic and start the treatment again. So these dogs needs continuous, permanent treatment to be controlled. Or for example, this dog is receiving cytopoint, right? And the owner waits until the dog is real pruritic to make an appointment and do the next injection. Explain him that it's better to make next injection as soon as first signs of pruritus are back, or maybe even a bit before, if the dogs receive cytopoint not the first time, and you know this interval it needed to be controlled. Yes, I wanted to say about apaquel. In my experience, it works better sometimes when applied 2 or even 3 times per day. So it's very quickly disappearing from the body, right? And sometimes when we lower the dosage, right, the dog was responding to our induction treatment with, let's say, 0.6 milligram per kg twice a day, responding beautifully. We want to reduce this dosage, and we start to use 0.6 milligram per kg once a day. And it escapes control. And sometimes it's not necessarily the dosage, the day dosage may remain the same, 0.6, but divided in 2 dosages. So treat this dog with 0.3 mg per kg twice a day. Sometimes it's enough to keep this dog under control. Don't forget about local anti-inflammatory therapy. I like it a lot, especially for interdigital spaces, especially for the ears. I use a lot of local corticosteroids. Cortavance is my favorite by far. So a lot of itch, a lot of inflammation can be controlled with local treatment. Apart from corticosteroids, you may use also calcineurin inhibitors, local drugs from the same family as cyclosporin, so it's tacrolimus or pimecrolimus. There are some generic drugs on the market in some countries, so it's not so expensive even as before, and these drugs may control a lot of atopic dermatitis. Don't forget about them. For example, for the ears, for the atopic dermatitis, for the atopic otitis externa, I almost in every patient use not only to control the signs, but to prevent recurrence. So I use ear corticosteroids as proactive treatment. For example, a lot of my atopic patients will receive Cortavans inside the ear canal every week or every 2 weeks to prevent recurrence of ear pruritus, ear inflammation. Skin barrier repair and maintenance. You know already that atopic dermatitis is not just about hypersensitivity, not just about wrong reaction of the immune system. It's also about skin barrier, insufficient skin barrier. So there is easy penetration of allergen inside the skin. There is easy penetration of secondary infections, and there is easy loss of water, of moisture from the atopic skin. So skin repair is playing a lot of role, and if you are atopic yourself, you know how much it means to use right cosmetics for your skin, right? To moisturize, to repair this destroyed skin barrier. And there is still, it's still a developing area for dogs, but there are a lot of good products on the market, the products that are approved scientifically that they are working, they are lowering atopic disease symptoms, and you can use orally some essential fatty acids. It could be food supplements, or it could be food, dry food with lots of additional good quality fatty acids, right? And of course you can use local sprays or spot-ons with fatty acids, ceramides, other lipids, with moisturizers. So don't forget about them, especially if it's a small dog, especially if the owner is motivated enough to deal with all this washing and applying of mousses, sprays, spot-ons, etc. Allergen-specific immunotherapy, so vaccination, it can be helpful. Although my own experience, my own response to acid is lower than in literature. In literature, it's about 65% of dog will benefit. In my experience, it's around 30 or 40% benefit. And by beneficial, I don't mean these dogs will get rid of every allergic symptom. Of course not. They will benefit if you can lower dosage of anti-inflammatory systemic drugs, or they benefit if you don't use any more systemic drugs. You can deal with just shampooing and spot-ons and some local corticosteroids. It's also good, right? Or maybe before you had a lot of recidived recurrence, a lot of secondary infections, but you don't have them anymore, and these um, recurrences of each are not so often, right? So try it in every dog whose owner is motivated enough, because it's not so cheap treatment. But on the other hand, it can be cheap if it's helping. It's not really so expensive as, for example, high dosages of oclotinib, right? Another possible scenario, everything is under control. So you did quite a good job, but there is some lesions or some lesion that doesn't answer your treatment. So maybe it needs some special attention, special treatment. For example, here you can see Dalmatian atopic dog with quite advanced acral leak dermatitis, and it may be not enough to just start, I don't know, anti-inflammatory treatment like oclotinib. Maybe this dog needs prolonged antibacterial treatment. Maybe it needs some intralesional corticosteroids. Maybe it needs some antidepressants or some painkillers like gabapentin. I don't know. Maybe you have to pay some special attention to this lesion, and it's not enough to treat with common drugs, right? Maybe this lesion you cannot control is not atopic dermatitis lesion. For example, this dog is having not responding pododermatitis, and it's not just atopic pododermatitis. You can see that there is some friction between this interdigital space and this paw pad, right? So there is wrong feet conformation additionally to atopic dermatitis. So maybe this dog needs I don't know, weight reduction, some orthopedic issues control. Maybe it needs surgery. Maybe it needs some, I forgot the name, but what you put on your feet, right? When you go for a walk. And here you can see bad case of atopic externa with a lot of hyperplastic tissue, with a lot of hyperplasia of ceruminous glands, so it's completely closed. And sometimes these chronic lesions are respond poorly to drugs, to medicaments, right? And again, maybe you need surgeon help to take this atopic lesion. Actually, it's a consequence of atopic otitis externa, to take it under control. Another scenario, and it's can happen, poor compliance, right? So the owner is not following your recommendation or your colleague recommendations, and this dog is not responding to treatment because it's not receiving one or not receiving all of treatment you prescribes. And there is different reasons for that. Sometimes owner doesn't understand what atopic dermatitis means. It doesn't understand it should be permanent treatment, sometimes year-round treatment, sometimes almost in every case lifelong treatment, right? So nobody explained it to him, and it's treat, each disappears, it stop treatment, it come backs, and it starts, the owner start treatment again, etc. Sometimes the owner understand disease and lifelong treatment, but it doesn't understand the treatment itself. So solution take time to properly explain. Maybe during the visit the owner is stressed. Sometimes they are stressed a lot, especially if the dog is not behaving right, it's aggressive or panic, and then the owner is somewhere else with its mind. So give him some handouts, tell him you can ask me additional questions, emailing me, etc. Take some time, take some effort to explain treatment and disease. Or maybe owner cannot do it, right? It's not possible, physically not possible. For example, especially with local treatment, the dog may be aggressive or too active, not compliant, so the owner cannot apply these eardrops or cannot apply this spray. Sometimes you like asked to shampoo the dog, but it's not physically possible. For example, it's an old lady with a huge giant dog that maybe lives outdoor, but you ask this owner to shampoo the dog like twice a week, and it's not possible, right? The owner didn't say anything during appointment, but then she or he came home and they cannot do it. It's not possible, right? So solution, be smart and don't advise treatment that may be not possible. If you see during the appointment that the dog is not easy and doesn't let you or owner touch the ears, so do something about it. Treat maybe first these ears with systemic treatment, and after pain and inflammation will be gone, there will be some long period to gain this dog's trust again, that you can touch the ears, you can apply local treatments, etc. Sometimes there is no money enough, and maybe owner didn't tell that during the first visit. You started, I don't know, Apoquel treatment, but actually after buying first package of Apoquel, owner understands, my God, I will spend during first months of treatment, I don't know, 200 euros for my dog. I cannot afford it, and it stopped, and the treatment stopped. So be sure that it's financially affordable. Tell owner how much it will cost, not just the first course, not just the first package, but the month or year. And of course you can tell him that probably this dosage will be lower it, and you will spend less money during the second month, but this induction needs so much money, right? Discuss it through. Be sure that it's something the owner can afford. Yes, no money. I'm not sure myself if I would have some, I don't know, Great Dane or even German Shepherds with atopic dermatitis that I can afford apoquel treatment for it. And of course, there will be owners who are not motivated enough. And sometimes it's not bad person. They have other family members who are sick. They have lots of other troubles. So at the moment, there is no motivation enough. Do what you can to raise this motivation through the explanation, um, through the friendly explanation. If you become aggressive or blaming, it's not working. It will not raise their motivation. Yes, it's not how it works. Be friendly, be positive, be open to discuss where it comes from, this lack of motivation. Sometimes there are very good reasons for not being motivated enough, for forgetting to treat the dog. Yes. And scenario number 6, nothing works. Or maybe there are some side effects. Maybe there is a drug that is working, but the dog developing side effects. And that's the worst scenario possible, right? What to do? There is some drugs that maybe not so much available on the market, and maybe there is not enough evidence, not lots of studies done, but they can be promising. So you may try them. For example, interferons. There is some feline omega interferons, and study was done for treating canine atopic dermatitis, and it was quite promising. There are also some canine interferons. I know that there is in Japan Interdog company, if I remember well, who sells interferons, dog interferons, and there are some studies that show good effect for atopic dermatitis. I know Japan colleague is joining this webinar. I don't know if this colleague is here at the moment, but maybe you can comment if you use this interferon. Some probiotics show some promise in controlling atopic dermatitis. Vitamin E, you can try pentoxifylline in large dosage. It's a challenging name, but I will try. Palmitoyl, I will try again. Palmitoyletanolamide. It's a lipid compound that used in human medicine to reduce neuropathic pain and inflammation, and it can be effective also in atopic dermatitis, also in canine atopic dermatitis. So it's something to try, and it's available even in so-called health stores. If you are desperate, you may try some drugs with not enough evidence, or maybe not scientific evidence of efficacy, or maybe there was some evidence but low efficacy, or maybe there is some quite good evidence of efficacy, but side effect risk are quite high. So you may try maropitant, Serenia, you may try antidepressants, you may try gabapentin, you may try cytotoxic drugs, azathioprine, meflunomide, methotrexate. You may try antihistamines. You may be surprised that antihistamines are here, not in anti-inflammatory drug section, but I don't have a huge belief in antihistamines. You know well that in a lot of studies they just show effect that is the same as placebo effect, but sometimes antihistamines in some dogs are working, maybe through their sedative effects, right? But it's something to try. Maybe it will not be effective as a monotherapy, but if you add it to your, I don't know, prednisolone, and it will allow you to reduce prednisolone dose that is having side effects in this dog, it can be helpful, right? You may try even acupuncture if you are desperate. You can try masitinib. In a study, it has low efficacy, but still there are some dogs who may respond. What's next? I guess in the future there will be more monoclonal antibodies like the one we have now, lokivetmab. It's monoclonal antibodies against interleukin 31. In human medicine, there is quite few MAPs, monoclonal antibodies, studied at the moment or evaluated in treatment of atopic dermatitis. It's anti-interleukin antibodies or even IgE antibodies. I guess in near future in veterinary medicines there will be more MAPs, right? That's pretty all. So ask your questions if you have, and of course comment or share your experience with treating bad responding atopic dogs in chat section, or maybe you want to ask your question by mouth. Do so. So switch on your microphone and comment, ask by mouth. There will be more webinars for charity. So keep in touch, and I will share this schedule with you as soon as possible. There will be great speakers from all over the world with very interesting topics. So I hope you will join once again these charity webinars. So I will see what's going on in the chat. Daniel asks, if a dog is on isoxazoline therapy, shall we assume that scabies autodectus not possible? These drugs will not be effective forever, right? And me, myself, so far, I didn't see the dog who was receive isoxazoline treatment and right interval and right dosage and was positive for scabies mites or other mites. But I guess it's not something we just trust 100%. And apart from cases that this dog received the treatment a week ago and it's still positive for the Modex, it's not yet the case of not response, it's just too soon, right? But I know that some of my colleagues, for example, I remember the case from France, were reporting that the dog was, I don't remember, honestly, I don't remember what was the treatment. I remember it was a tablet, but it still was positive for scabies and scraping. So I guess that's possible. Is it due to fact that dog was splitting out this tablet, or it's something that is more scary, resistance of mites? I don't know, but I guess we should not trust it like 100%, right? So far in my experience, I didn't see the cases not responding to this treatment, but maybe we will have them in future, right? Alicia, in the atopic dog, what do you prefer, Apoquel or Cytopoint? Thanks. I guess I will start with Apoquel, right? Maybe there is depending on the dog, right? If it's the dog never tried Apoquel or Cytopoint, usually I start with Apoquel, right? Because it's quite quick. During first week, I will understand if it's working or not. A lot of my dogs, they come from afar, so I don't like to inject Cytopoint because sometimes it's not working or it's not working enough and they're gone. They have to come back for different treatment. And with Apoquel, if it's working, they can buy this treatment there, right? And yes, my preference start with Apoquel. If not working, if not working enough, I may try Cytopoint. But also my experience is if Apoquel is not working like at all, Cytopoint may not be effective in a lot of cases. So if Apoquel is not working, I will try to understand why it's not working. Sometimes there is additional secondary infection. Sometimes there is a dosage not enough, right? Yes. If the question is which one I start first, usually it's Apoquel, but it's not something right or wrong. Maybe there is some of you who prefer to start with Cytopoint. By Cytopoint is a very, how to say, narrow efficacy. So I would keep it for a dog who are already took under control, maybe with corticosteroids, maybe with oclotitinib, but it's at the moment already not itchy and it's quite controlled. And then I may discuss Cytopoint, right? Or maybe I start with Cytopoint if there is difficult to give treatment per mouth. There are some dogs like that, right? So the owner prefers injections. Yes, there is a Tokyo colic. Interzoc is not effective so much in dogs with atopic dermatitis. I think it's not popular anymore in Japan. That's pity. Um, Daniel, do you assume a dog very unlikely has scabies, demodex, or todectus if they already taken isoxazoline? Yes, I assume so, but I still will check. I will check with scrapings or microscopic examination of cerumen. Of course, it's not like always diagnostic. We know well that sometimes we don't find mites. So I double check if the right drug, right dosage with right intervals was like used. I double check if every family pet was receiving the treatment and there is no continuous reinfection, right? But usually, so far, isoxazolines, in my experience, very effective in killing the mites, right? Radvil, how long you use high dosage Apoquel twice a day? Usually I do it as Zoetis recommends, so it's around 2 weeks. Sometimes it's a bit less if the itch was not huge and the dog is answering very quickly. I may reduce the dosage after a week of high introduction dose. Sometimes it's a bit more than 2 weeks if the itch, initial itch was a lot and the dog is not answering so quickly, so maybe it will be 3 weeks. So after remission, I will try to reduce it. In some dogs, it will be recommended reduction, so by half and once a day. But in a lot of dogs with lots of pruritus, initial pruritus, and I will reduce more slowly. Like for example, it was 0.6 twice a day, so I will reduce. I will the morning dosage will be the same, 0.6. I reduce by 50% just the evening dosage, like it will be 0.6 and 0.3. And if it's working, I will reduce the morning dosage then, so it will be 0.3 in the morning and the same dosage in the evening. If it's working, I may reduce it further. So I always, with every drug, try to find so-called minimal effective dosage. So I will not stop with just effective dose. I will always try to reduce it and play with the dosage and try to find the smallest dosage that is effective, right? Yes, and sometimes in some dogs there will be this induction dosage for a long period of time, like maybe forever, because it's not accepting any lowering of the dosage, and I cannot be like change the drug. Other are not quite effective, and I cannot lower the dosage with additional options like local anti-inflammatory treatment, skin barrier repair, vaccine. Nothing is possible. Then this dog may stay on the high dosage like forever, off label of course, and it should be discussed with owner, but still. Do you take some blood sample? If you do, how often? If you question about blood sample is regarding Apoquel usage, yes, I do. I should be honest, I don't do it in every patient. So if it's a young, healthy patient, I may skip that, or sometimes I just forget that. But of course, it's advisable and it's a good approach to take basic blood samples before starting any drug for a long time, even if it's drug with low side effects like Apoquel, right? You take blood, a basic blood sample, and then you recheck this blood analysis in a half a year or once a year, right? To be sure to kind of mm, know everything that's going on in the blood. Daniel, one day, however, we will see resistance, we should assume. I always be sure to check anyhow. Yes, I think so. It's I guess it's not possible this excellent response forever, right? I guess we should be ready that someday it will not be so effective anymore. Varpo, thank you so much for an interesting lecture. Thank you. I hope it was helpful. I hope it was interesting. Ami, Apoquel can reduce, but always 2 times daily for a long permanent therapy, I guess. Yes, very often Apoquel should stay twice a day in order to be effective. I agree. Sometimes I even do it like 3 times a day. Daniel, I recommend a lot of supermarket brand fatty acid therapy. This is not a branded on label product for the veterinary market. I recommend cold pressed hemp seed oil, for example. Do you have a preferred source of omega acids that you would recommend? Thanks. Yes, it's usually I use Megaderm by Virbac. It's something that studied well. It's something that's long time on the market. So I guess I just used it a lot and I'm used to it, right? So maybe there are better sources or cheaper sources, but it's something that I have for a long years on my shelf. So I use it a lot, like Peros source of fatty acids. I also use much more special food for atopics. Of course, you're never sure how much additional relief it gives, but if there are special food developed like heels by heels or specific or royal canin, why not to use it, right? Hoping that it gives it helpful part to this puzzle of management, right? Yes. So guys, do you have more questions? Or maybe some comments, or maybe you can share your experience, how you controlled your bad atopic. Okay, if you don't have any other questions, we finish for today. Thank you very much again, and I see you somewhere else, maybe offline in Porto. Come to say hi, and maybe online, maybe even online during this charity webinar series. Thank you again for your participation, and have a good weekend. Yes. Bye-bye. Bye. See you in Porto. Yes. Thanks a lot.